Hey folks, my name is Rob, and that guy being sketched out in the bottom there is actually me. And today I want to talk about Medicare Part B and some costs associated with Medicare Part B, as well as deductible, sample coverage, and also some ways that you can help to offset your costs with your Medicare. So if that sounds good, we'll move on to the next slide where we can talk about all these things. Thanks. Hey folks, so as promised, we are going to talk about some of the costs associated with Medicare Part B. And for 2020, the standard premium, monthly premium for most people will be $144.60. And again, that's for 2020. It's actually up $9.10 from 2019, which that premium was $135.50. And that's according to the Centers for Medicare and Medicaid Services. So with that said, you do not have to enroll in Part B when you first become eligible. In other words, if you're still working and you have health care coverage, you may not want to enroll in Part B until you retire, or let's say you lose your health insurance coverage. And again, I'm not telling you don't do it. I'm just suggesting perhaps that you want to really look at your particular situation and discuss it with your employer or your HR person and see what might be best for you, because I have a lot of clients that delay enrolling in Part B just because they're still working and they don't need to be paying the premium right now. So again, really up to you. It's your call. But the annual deductible for Part B will rise to $198 for 2020. It's up about $13 from 2019. So again, these premiums and deductibles all vary from year to year. I'm just kind of telling you right now what the deal is for 2020. I'm sure it'll be different for next year and the year after, because these things rarely go down. It's usually going up. So with that said, I would say that really with Part B, I don't, I'm going to talk about how in a minute here how Part B actually does work, but it's the old 80-20 rule. So Medicare is going to pick up 80% of your expenses, and you're going to be responsible for the other 20%. So again, you have to meet your Part B deductible first. And again, like I said, it's $198. And let me just talk about what Medicare Part B actually does cover. I'm going to give you some examples. You can always check out my website for more information below this video. But what it does cover is medically necessary services or supplies that are needed to diagnose or treat your medical condition and meet accepted standards of medical practice. In other words, it covers health care to prevent illnesses like the flu or detected at an early stage when treatment is most likely to work best. You pay nothing for most preventative services if you get the services from a health care provider who accepts assignment for Medicare. Now, what does that all mean, folks? Obviously, your once-a-year preventive checkups, you're not typically going to pay anything. But let's say you do get diagnosed with the flu, or you have anything where you got to go see the doctor, you're again going to pay that first $198 from there. And then it also covers things like clinical research, ambulance services, durable medical equipment, mental health, inpatient, outpatient, partial hospitalization on an outpatient basis, and several other things. But really, in a nutshell, once you've met your Part B deductible, then it's going to cover these type of services. And also, you're going to be on the hook for that 20%. And that doesn't sound like a lot, folks, but I'll tell you what, when you start getting bills, I have clients that have to go in and do treatments, and they 20% of 20,000 is a lot. So what I want to do in the next video is talk about how you can offset these coverages and protect yourself from potentially high bills. So let's take a look at that next video. Thanks so much. So as promised, folks, just wanted to make this quick video about how you can kind of protect yourself from some of the higher costs associated with Medicare, because again, you're on the hook for that 20%, whether it's for the hospital or for, that's Part A, by the way. I can talk about that in another video. Or right now we're kind of focusing on Part B, which again would be your doctor services, your outpatient, your medical equipment, diagnostics, durable medical equipment, that type of thing. So one of the ways that you can do that, it's through purchasing a Medicare supplement plan, or what they call Medigap plan. And the reason it's referred to as Medigap because it helps to plug the gaps in Medicare. So again, you've got a couple of different plans out there, and they made some changes for 2020, and I want to point something out. Plan C is going away, and so is Plan F. If you've already got them, you can keep them. I'm just saying, anybody that isn't in it by January 1st of 2020, you no longer can get in it. So if you notice, those plans picked up the Part B deductible. But that's not to worry, because like we said, for most people, $198 isn't going to sink your finances. But 20% of some of these things really, really could. So again, for A and B, these plans really are for people that are under 65 or who are disabled. I'm not saying if you're over 65 and eligible for Medicare, you can't get into them, but they can be quite costly, believe it or not, and they don't cover as much as, like, let's say a Plan G. So Plan G, once you've met your Part B deductible, it's going to pick up 100% of your Part B, your other co-insurance, in other words, after you've met that deductible. Same with Part A deductible. It does pick that up, however. Picks up the Part B excess charges. So it's a very attractive plan. And a lot of people are, it's been just as popular as Plan F. Like I said, F is going away. F used to pick up that Part B deductible. But anyway, the other plan that's very, very popular is Plan N, because it's very affordable. And the difference though is that it's going to pick up, aside from the Part B coinsurance, you still have to pay the Part B deductible. But you only pay a copay payment of like $20 when you go to the office. So it kind of works like a little bit. I don't want to say it works like a Medicare Advantage plan, but Medicare Advantage plans, which are completely different, they have copays on them. So again, if you're interested in those, I can do a video about those as well, and how they are different from a Medicare supplement or Medigap plan. You can't have both. You either have one or the other. So again, just a quick chart. You can check it all out yourself. And again, you can go to my website and see what all is covered. But I just want to show you real quick how you can help to offset and have predictable costs for your Medicare each month if you're nervous about how you would come up with the deductible payments and the coinsurance for the 20%. So anyway, that is it, folks. I appreciate you watching the video. And again, as always, give me a call if you have any questions. I can actually write all of these, so or help direct you to be able to enroll in these plans. So thanks so much. I appreciate it. Have a great day.